Don't get implants until you see this. I'm here to tell you this. Dental implants might be the best investment you ever make for yourself, but only if you go in to know what you're actually signing up for. Today, I want to walk you through the things I wish every patient knew before sitting down in my chair. Because the more informed you are, the better outcome is going to be. It's really that simple. So let's start with debunking the biggest misconception of all. A lot of people come in expecting this procedure to be one and done. You sit down, and maybe an hour later, you're back in your car with a new set of teeth. Well, I understand where you're coming from. You see these before and after videos on TikTok and YouTube, and you think it's as simple as that. But when it comes to full mouth implants, there's a lot that goes on behind the scenes that the internet just doesn't show you. So let me show you actually what happens. As you can see, when we place dental implants, it's just a small titanium post that goes into the jawbone. And that post has to fuse with the bone. Now, it doesn't happen as quickly as the video just showed. It can sometimes take weeks, even months, for the bone to completely grow around the implants. That's what we call osseointegration. And that's what makes implants so stable long term. But what if the bone has shrunk and weakened, which naturally happens when your teeth have been missing for a while? Well, in that case, we sometimes can't place the implants right away. We'll need to rebuild that bone first with grafts. That way, the implant has something to latch onto. The thing is, bone grafting can take another 3 to 6 months to heal and integrate with the jawbone. But once everything is looking good and the implants are placed, you'll be going home after that session with teeth. Most of the time, we use fixed temporary teeth during healing. In any case, the final teeth can only go in once the foundation is solid and everything has healed. So if you're in the San Antonio area and you're considering full mouth implants anytime soon, the first thing you need to do is ask yourself, am I prepared for this process? If you need guidance when making this decision, you can always come talk to me. I've put the link in the description. And this is one of the things I want to be clear about when it comes to this treatment. Yes, this is surgery. So the procedure isn't completely painless, and you won't be back to normal the next morning. Here's a glimpse of what you might experience right after the procedure. You'll feel numb, first of all. Then you'll see some swelling, maybe even some bruising, or even some mild discomfort in the following days. That's all part of it. The swelling in particular tends to peak around day 3. So if you wake up on that third morning and look in the mirror, it may seem worse than the day before. But don't worry, that's not a sign that something went wrong. On the contrary, it's actually your body doing exactly what it's supposed to do. Minor swelling and bruising is completely normal. Your body is rushing blood flow, nutrients, and everything it needs to that area to rebuild and integrate. So the inflammation that you see, that's your immune system showing up to work. And it only means that things are moving in the right direction. For most people, things start to calm down within about a week. For others, it could be more. It really depends on how your body reacts to the procedure. And that's why it's really important for us to screen patients before we offer this treatment. See, not everyone who wants dental implants is automatically ready for them. And I say that not to discourage you, but because I think it's one of the most important things to understand before we go any further. The success of an implant doesn't only come down to our skills as dentists, but more importantly, to what's going on inside your mouth and your body. So there's a few things we look at during a proper evaluation. Bone is a big one, because if you remember, implants need something solid to fuse with. If the bone isn't there, or isn't strong enough, we need to address that first. Then there's gum health. Active gum disease and implants don't mix well together. So if that's something you're dealing with, that gets taken care of before anything else. If we're taking out all of your teeth, it's not that important. But if we're keeping one arch of teeth and they have gum disease, we definitely need to fix that first. Besides those, we also ask about smoking, because smoking significantly affects how well your body heals and how well the implant integrates. It doesn't necessarily mean the implants are off the table, but it's a conversation we need to have. We have to talk about certain medical conditions, like uncontrolled diabetes, since this can also affect the recovery process. Now, this seems like a lot of criteria to meet, but I'm telling you, it's a form of protection, not hindrance. It's what stands between you and regret. So, if you want to know whether you're a good candidate for dental implants, you know where to find me. But first, let's talk about something most dentists probably just gloss over. Yes, dental implants have a really high success rate, reaching somewhere in the mid to high 90 percentile. But if you'll notice, it's not 100%. So there's still a chance for the procedure to go sideways. And while implant failure is uncommon, it's not impossible. That's why I'd rather you understand what can go wrong so you can help make sure that it doesn't. First off, there's a few things that can interfere with the success rate of an implant. It could be a poor healing response, like your body just doesn't integrate the implant the way we'd hope, or it could be an infection or inflammation. This usually happens when you put too much pressure on the implant before it's had a chance to fully fuse. And the way that could happen is if you chew on the wrong side or you go back to hard foods too soon. On top of that, just like what I mentioned earlier, smoking and uncontrolled medical conditions can affect the healing process too. But failure doesn't always look the same. Sometimes the signs appear within the first few months of implant placement, and that's what we call early failure. Other times, it happens years down the line, which is what we refer to as late failures. More often than not, the reason behind a late failure is tied to hygiene. People assume that because an implant isn't a real tooth, they don't have to take care of it the same way. Well, that's not true. The soft tissue and the bone around it still need attention. So yes, it still requires proper maintenance. But that's not the main point. What I really want you to take away from this is this. Failure, if it happens, is not the end of the road. In most cases, it's manageable. Often, it's correctable. It's not like the whole thing falls apart and there's nothing we can do. No, we figure out what happened and we troubleshoot. But before we ever get to that level, we have to try everything we can to avoid it. One way to do that, take care of your implants. It's true that implants don't get cavities. That's because there's no enamel or decay. I mean, come on. But the bone and gum tissue around them are still very real, and they need to stay healthy. If plaque builds up around an implant, it can cause inflammation. And over time, that inflammation can lead to bone loss, very similar to gum disease around natural teeth. This is also known as peri-implantitis, which if you remember we talked about earlier. That's actually one of the leading causes of late implant failure. The good news is, implant maintenance isn't that complicated. It's just daily brushing, flossing, routine dental checkups, and professional cleanings. Before you know it, taking care of your implants is like second nature to you. You'll stop thinking about it and just becomes part of your routine. So yes, dental implants can absolutely change your life. I've seen it happen hundreds of times. But every single one of those outcomes had one thing in common. They went into it informed and prepared. They didn't rush, nor did they make the decision based on a late night Google search. They took the time to understand the process, ask the right questions, and make sure everything was in place before moving forward. And that's really my goal here. I wanted to give you the information you need so that you can make the right decision for you, while taking into consideration your health, timeline, and of course, expectations. If you have questions, or you just want to talk through where you're at, you know where to find me. I'm always happy to help. So, now you know what you're signing up for, but here's what most people get tripped up on next. They assume the decision between full mouth implants and dentures is obvious, until they actually sit down and look at it properly. In the next video, I walk through what actually separates the two, and why most people end up changing their mind once they see the full picture.